The goal for today is to set the policy agenda for patients with rare diseases. We at NORD see ourselves as the driving force working to actively bring positive change for patients with rare diseases. Through our discussions today, we hope to again be a catalyst for change. We've invited the leading thought leaders in the country who are here today to help us better understand the strategies and programs that must be put in place to best represent the needs of the 30 million patients with rare diseases. The policies that NORD advocates over the next few months and years must assure that patients with rare diseases have their interests at the policy table represented and are not left behind as changes occur with healthcare reform.
This very exciting national debate on healthcare reform. NORD has always taken a central role in leadership. I remember I was a junior Hill staffer when the idea of an orphan drug legislation 25 years ago was raised. And I think for all of you who've been involved over the last several decades, the progress is very, very real, from the patient groups to the agencies, to the Hill, to the industry. The progress is, I think, close to historic if you look at what's been accomplished. But we're living in a very different world. Well, the way I'd like to do this today is, certainly my job is to listen and just help facilitate. Maybe herd cats is a better way to do it, because there are a host of different avenues we can go down, a host of different roads. Access, innovation, obviously key. How do we continue to push the pipeline? How do we design studies that make sure the outcomes are good for patients? How do we deal with drugs that are today viewed as too expensive both to develop and to pay for? The challenges, in some ways, with all the progress, still remain very great.
Now, but one of the changes that we're seeing, and this is what I want to talk about, is that we have an increasing involvement of nonprofit and disease advocacy groups in not just funding research, basic biomedical research, which they've been doing for 4 decades at least, okay, but in actually getting involved in the development of drugs for their disease that they're interested in. And so that is a big change that we're seeing. And we don't know at the moment how successful this is going to be. But early indications seem to show that this focus by the disease advocacy groups and some funding are making a difference in pushing drug development in certain areas toward those desired diseases. And so my thesis that I want to talk about in my remaining 9 minutes is that the orphan drug community can take advantage of the changes. You know, if you understand the changes that are occurring in the industry, the changes that are occurring in academia, the new opportunities are being posed, that NORD could potentially take advantage of these changes to really help advance the development of rare diseases.
Thank you for giving me this opportunity to speak to you, but more importantly, let me say thank you to you for what you stand for. Winston Churchill said, "We make a living by what we receive. We make a life by what we give." When I look at this audience and look at the speakers and the dais and the absolute outstanding, motivated individuals, I would have to say thank you. You are absolutely what this country needs at this particular time. And NORD is very well represented because of your capabilities, your desire to do what is Winston Churchill's talking about, and making a life for people that really need your particular help. And then Margaret Mead said, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." And when I look at this group, the daunting tasks that face you, and the patient groups that you are involved with, and the patients you're involved with, I think Margaret Mead said it best. A small group of individuals very committed can change the way we do things in this country, and for patients that need our help a great deal. Is that right now is the most important time for you to be in Washington. And right now is the most important time for your organizations to be involved. First, for the rejuvenation of FDA. Secondly, to be involved in Medicare. Third, to be involved in comparative effectiveness. And fourth, and most importantly, the transformation of healthcare that's going to be marked up in June and July that's going to pass. And is it going to be passed with provisions that NORD finds acceptable? Or are we going to be left out? And that's the best of times and worst of times of healthcare today. And so, ladies and gentlemen, my message is that it is the best of times and worst of times right now for healthcare in America, and for NORD and for FDA. And the nice thing about it is that we can change and improve over the course of the next several months. And it's not going to wait till next year when you have your annual conference again. Right now, things are moving very rapidly. And they're going to move a lot faster than most people expect. And the healthcare system that we know today is going to be completely transformed over the next 12 months. Now, that transformation can be the best of times or it can be the worst of times for our group. The best of times would be to expand the Orphan Drug Act, give FDA the resources it needs, and allow FDA to make those correct decisions, and encourage FDA to be involved with the orphan drug movement as much as they possibly can be, to understand our concerns and approve the drugs.